Thank you, Madam Speaker. I heard the Premier's comments about healthcare at noon. I thought I would table some facts. One is a document that shows Canadian healthcare transfers have never been over 26% at any point in the last 45 years, and they're going up even as this government froze and cut. Two, CAHI statistics that show that hip, knee, and cataract replacements all got worse under this government. CAHI, year over year over year. Three, an article showing that in 2007, the Premier and the Premier of Alberta, both as Conservative MPs, voted for a fundamental change in health transfers that cut funding to provinces with aging, Indigenous and sparse populations, including Manitoba. Why should we believe the Premier and his MLAs when they say they want more healthcare funding? Because when they are in power, federally or provincially, they cut.
The Honourable Minister of Health.
Madam Speaker, yesterday the federal government dictated to provinces across our country as to the second dose of the vaccine and how it would be and how much would be delivered to the provinces, Madam Speaker. They had given 4 options to the provinces. One was on a per capita basis, one was based on Indigenous populations, another was based on elderly populations, and the 4th option, Madam Speaker, which is the option that Manitoba chose because it's in the best interest of Manitobans, Madam Speaker, is based on Indigenous as well as elderly populations, Madam Speaker. I would suggest that if the member opposite wants to do what's in the best interest of Manitobans, that he gets on board and stop representing Ottawa and start representing Manitobans.
The Honourable Member for St. Boniface on a supplementary question.
Thank you, Madam Speaker. Still on healthcare, we have to question the government's decision to only set up 3 super sites so far, because instead of taking vaccines to seniors, this government is forcing vulnerable seniors and their caregivers to spend thousands of dollars to travel for hours to get vaccines. There are currently 3 super sites with a couple more planned. I table a CTV News story from last month showing that Saskatchewan, by contrast, will have 230 vaccine clinics in more than 180 communities across the province. It's not just unfair and expensive, it is bad public policy. Is this government going to stop forcing vulnerable people in their 60s, 70s, 80s, 90s and older to travel, wait in line, pack into planes, or are they going to do the right thing, the smart thing, the safe thing, and make sure vaccines go to where people are living?
The Honourable Minister of Health.
Thank you very much, Madam Speaker, and we are committed to ensuring that the vaccine gets out to Manitobans who need it on a timely basis, Madam Speaker. The unfortunate part, Madam Speaker, is that the federal government, his colleagues in Ottawa, have not been delivering the vaccine to the province of Manitoba. Again, I would hope that he would get on board to ensure that the federal government delivers more doses of the vaccine for Manitobans who need, want, and deserve it, Madam Speaker.
The Honourable Member for River Heights.
Yeah, Madam Speaker, unlike British Columbia, which has prioritized individuals with medically fragile conditions, underlying health conditions that render them extremely vulnerable, I table the list. The Manitoba government has been slow in its vaccine policy to prioritize individuals with medical conditions which put them at high risk for severe infection with the COVID-19 virus. Surely individuals who are less than 65, and including those less than 50, should be considered to be prioritized as British Columbia has done. We are receiving many letters daily from such individuals. When will the government put a priority on vaccinating all very vulnerable individuals in Manitoba?
The Honourable Minister of Health.
Thank you very much, Madam Speaker. And those decisions are not made by politicians, they're made by the medical team on our vaccine implementation task force, Madam Speaker. They are responsible for deciding the priority list for those who get the vaccine in the province of Manitoba. We will continue to rely on them for that advice, Madam Speaker. But again, I will remind the member opposite that those people in their 50s and 60s can't get the vaccine unless Ottawa delivers the vaccine to Manitoba. So once again, I will ask and call on these Liberal members of this House to call on their cousins in Ottawa to ensure that Manitoba gets the vaccine that they need, want, and deserve, Madam Speaker.